Okay, I think I must touch on this aspect of what is known as, we've been talking about New Zealand having an election because they were able to do it. The R naught, that R naught, as you very well know, the technical term of infectivity and spread, or were below 1. So you have two aspects. One is super spreader in person and super spreader events. An election is a super spreader event, and much like other super spreaders event like concerts, for that matter, sometimes even religious gathering and whatnot. So yes, unless you could do it like online, then there's hardly any reason why you should cause that kind of setting to be, to compromise on the health and life of our people. So unless you get that done, you cannot have election, because election, especially general election as well as state election and by-election, they are super spreader events that must not be allowed in these circumstances. So yes, of course, I think we got to understand that, and Sabah is a glaring example, is a living example of why we are now back to being conditionally MCO'd in Putrajaya, KL, and as well Selangor now. So much as it has been said to be not only due to cases coming from returning from Sabah, but as you very well know, the earlier cases were all returnees from Sabah and clustered, with index cases, linked to Sabah's returnees. Unfortunately, it's tied up to Sabah as the epicenter of sort. Now, to answer that question briefly, I think you have to look at it. It's not a binary answer of yes or no, but rather I would take it like, in all fairness to MOH, that it must be seen from two perspectives. Essentially, one from the hospital-based, curative care-based, where acute care or medical care, that is one aspect. To what extent it has been strained, and of course the other is that aspect of public health. How under what circumstances and how strained and stressed our medical facilities are, it's best reflected perhaps in Sabah. And that's where you get to see, I'm not quite sure about the most recent data on this, but you get to actually, you come to know that by way of ICU, you get to see that I think it's about 75%, and of course there are also quite numbers that are intubated, ventilated, and despite quarantine centers being built, you still could see that there are, by way of hospital bed being occupied, I think it's no less than even 75%. So yes, if from that perspective, you could see that it's really stress, and you could also, that is from the medical aspect, the hospital base. The other is of course the public health, the public health dimension, which is of course that is related to, shall I say, how well are we with contact tracing? How well are we to maintain, to manage the spread, community spread, the clusters, and not the least, of course, the aspect of testing. To what extent has there been backlog of testing? So I would be very restrained in to say it's a yes or no. But from this perspective, you could see that given the MCO we had and the respite that the time that we were given, to really get prepared. And we have been saying, and SDFC particularly has been saying that it's going to be a long haul. Now, in all fairness, Semenanjung, West Malaysia and Borneo, you get to see that there must be a short term and a longer term kind of. So I think on the short term, how Sabah has not been prepared despite the election being allowed. Therefore, I think to a large extent you can't give a high mark for that. And a longer term, enhancement of facilities, in the sense of universal health care coverage kind of thing, I think you cannot, that may be that that is clearly that has not been properly addressed.